is Annie. I'm your nurse today. How are you doing?
Good.
Good. Okay, so I'm here today to do a head-to-toe assessment on you. Is that okay?
Yes.
Okay, perfect. So first I'm noting that he is alert, and I'm going to ask you a couple questions. Can you tell me where we are?
Oxford Grove.
Can you tell me what we're doing?
My head-to-toe assessment.
Can you tell me your name and your date of birth?
Stephen Crean, June 10th, 1963.
Okay, and person? And can you tell me what month it is?
November.
So he's alert and rated times 4. I am noting that the color of his skin is normal, that there's no cyanosis, that there's no pallor, and I am also noting that cognitive function is intact. He is able to answer questions appropriately, and that the speech is a normal rhythm and rate. I will perform a Snellen exam to test for cranial nerve number 2. I would take height and weight to test for BMI. I would take the vital signs, which are blood pressure, heart rate, SpO2, respirations, and temperature. And now I'm going to move on to the face and head, and I'm inspecting the face and the shape of the head, that it's normocephalic. I'm inspecting the hair and the hair pattern and the scalp. I'm palpating the head for any lumps or bumps. Do you have any pain?
No.
Okay, and then I'm inspecting the hair to see if there's any infestation or any lesions, and noting the hair pattern. And I'm inspecting the face for symmetry. Can you raise your eyebrows for me? Clench your eyes, and then smile with your teeth, and then frown. So I'm noting the symmetry of the face to see that cranial nerve 7 is intact, and then I'm also going to palpate the frontal sinus and the maxillary sinuses. Did you have any pain?
No.
Okay, and I'm seeing if there's any pain or any tenderness or pressure. And then I'm also going to have you open up your jaw for me. Good, and then close. Okay, so I'm seeing if there's any crepitation of the temporomandibular joint and the strength of the temporal and mastoid muscles. And now I'm going to look at the eyes, and I am going to test the 6 cardinal positions, and I'm noting any nystagmus or any lag, and I'm testing the accommodation. Good, and then I'm going to test the pupillary light reflex. Okay, to see that the pupils are equal, reactive to light, and accommodate. And I'm going to have you look up for me, and I'm looking at the conjunctiva to see that they are pink and moist, and the sclera to see that they are white. And with the cardinal signs, I'm noting that cranial nerves 3, 4, and 6 are intact. And moving on to the ears, I am looking to see if there are any lesions, any extraserum, palpating for any lumps or bumps. Do you have any pain?
No.
Okay, and then testing cranial nerve 8 with the whisper test.
Brown pillow.
White shoes.
White shoes.
Okay, so cranial nerve 8 is intact. And now moving on to the nose, I am looking at the nose, inspecting for any lesions, any bumps, inspecting the septum is intact. I palpated for the lumps or bumps. Did you have any pain?
No.
Okay. And then I'm going to have you put one nostril over your nose and breathe in. Okay, and then the other side. Okay, so did you have any difficulty with that?
No.
Okay, so testing for patency of the nose. And now I'm going to have you smile for me with your teeth. Good, and then open up. Good, say ah. And put your tongue up for me. Good, and now stick your tongue out. Good. So, noting that the mouth is symmetrical, that the lips are moist and pink, that there's no disease or bleeding of the gums, teeth are in alignment, or buccal mucosa is pink and moist, the soft palate is pink and moist. The hard palate is white-ish pink with rigids. The presence or absence of tonsils. The dorsal side of the tongue is pink and bumpy. The ventral side is veinous and glossy. There's no masses on the floor of the mouth. And that he's able to, his uvula rises with saying ah, which ensures cranial nerve 9 and 10 are intact, and then that his tongue is symmetrical when sticking it out, which shows that cranial nerve 12 is intact. Okay. So now I'm going to move on to the neck, and I'm first going to inspect and have you raise your head up for me. I'm looking for any thyroid enlargement, salivary gland, mandibular or sublingual gland enlargement, parotid gland enlargement. That's good. And then I'm going to have you stand up for me and turn around, and I'm inspecting the back of the neck as well, and then I'm going to, for any lumps or bumps or lesions, and then I'm going to start palpating the lymph nodes, so the occipital, the post-auricle, and the posterior cervical chain. Okay, and then turn back around and sit down for me. And then I'm also palpating the pre-auricle, the jugulo-digastric, the submandibular, submental, cervical, superficial cervical chain, deep cervical chain, and then the subclavicular. Did you have any pain or tenderness with any of those? Okay. So I'm assessing for pain, tenderness, if there's any lumps or bumps within any of the lymph nodes. So I'm going to assess the range of motion on the neck. So I'm going to have you turn your head one way, and now turn the other. Touch your ear to your shoulder, ear to the shoulder, and I'm going to have you look up and down, to your chest. Good. And I'm going to have you shrug up and then go against my hand. Good. Good. So I'm seeing if there's decreased range of motions, testing the strength of the neck and the shoulders, if there's any weakness or asymmetry, and with the strength of the neck and the shoulder shrug, I can say cranial nerve 11 is intact. And now I'm feeling for the carotid pulses that they are 2+ and symmetrical with a normal rhythm and rate. And then I'm going to oscillate with the bell of my stethoscope and just have you breathe out for me. Breathe out through your mouth. Hold. Okay. So I'm listening to hear if there's any turbulence or any bruit while oscillating. And now I'm going to move on to the upper extremities and first inspect for the color, if there's any lesions, and then feel for the temperature and the moisture. I'm going to look at the hands and look for the profiling 160 degrees, no signs of clubbing, and then the cap refill is less than 2 seconds. Same thing on this side. And then feeling for the radial pulses that they're 2+ and symmetrical and normal rhythm and rate. Good. And now I'm going to assess for range of motion. So you can, if you could just do some swimmer strokes for me. Good. So that's shoulders, and then have you do a bicep curl. Okay, that's elbows, and then do roll your wrists. So that's wrists, and then do jazz fingers. So hands, so checking to make sure range of motion is normal in shoulders, elbows, and hands. And then testing for any weakness or asymmetrical strength in the upper extremities. The shoulders, push against me, down, out, in, and then do bicep curl against me, and then go down. So that's shoulders and elbows, and then the wrist you can push up towards me, and then try to go down, okay? And then pull me in with your fingers, and then squeeze my fingers. Okay, so that's symmetrical strength in the wrist and the hands. And now I'm going to assess the lungs. So I'm going to start with the rate, rhythm, and depth of the respirations. And I'm just inspecting to see if there's any accessory muscle use. I'm going to have you stand up and then do the same on the back. So I'm seeing that there's no accessory muscle use. And then you can turn back forward, and I'm just going to, if you want, you can sit down. And going to listen to the lung sounds at the 6 different locations with the diaphragm. So you can breathe in through your nose and out through your mouth. Okay, so I listened to all 6 sounds anteriorly, then I'm going to listen to the middle lobe on the right side. Okay, and also just listen laterally. Okay, and then posterior, stand up and turn around. Listening to the 9 spots on the back. So I listened to I oscillated all of the lung sounds and I note the bronchial sounds on the upper lobes, the bronchovestibular towards the sternum medially, and then the vesicular sounds on the bases and the periphery of the lungs. Now I'm going to move on to the heart, and you can just breathe normally for me, and I'm going to first just find the apical pulse, which is midclavicular and the 5th or 6th intercostal space. And I'm going to listen with the diaphragm. For S1, S2, any extra sounds and normal rate and rhythm. And also, I am going to listen to the other heart sounds with the diaphragm and the bell. So the aortic, the pulmonic, the tricuspid, and then the mitral. Okay, so I'm noting S1, S2 present, or any extra sounds, abnormal rhythm or rate. Okay, now I'm moving on to abdomen, so you can lay down for me. And I am looking at first I'm going to do jugular distension, so I'll have you look this way. And I'm looking for any bulging on the neck, look the other way, any bulging on the neck. And now I'm going to look at the abdomen, look at the contour, that it is rounded, that it is a normal color, no palpitations from the aorta, and looking at the symmetry of the abdomen. And then I'm oscillating for the vowel sounds in all 4 quadrants with the diaphragm. And then using the bell for the different arteries, so the aorta, which is about an inch above the umbilicus, and then the renal, lateral to that, and then the iliac, which are inferior. Okay, and I don't hear anything, which is expected. I would note if there's any bruit. I also note that the inspection of the umbilicus is inverted, and then I'm going to do the light palpations of the abdomen in all 4 quadrants in a rotary motion, noting for any hardness or firmness, and then the deep palpitations, a little bit deeper, feeling for any masses or lumps or bumps. And do you have any pain with that?
No.
So now I'm going to assess the lower extremities, and I'm looking at inspecting the lower extremities for any lesions, and I'm feeling the temperature and the moisture of the legs, and I'm looking if there's any pretibial edema, and also feeling for the pedal pulses, and then for 2+ pulses, and then that cap refill is less than 2 seconds. And I'm going to assess the range of motion and strength of the lower extremities, so you can bend this knee for me, go up, and then go against me, good. Now this one up, against me, good. So range of motion and strength and hips, and then I'm going to have you do circles with your ankles, and then wiggle your toes, okay, and then push against my hands, and then down, good. And while I'm here, I'm going to do the Babinski's. Okay, so the toes curl, which is a negative Babinski's, and normal range of motion and strength in the feet. So you can sit up for me, please. And then I'm going to also test the strength of the knees, so you can hold this up for 5 seconds. Down, kick your leg out for 5 seconds. Now I'm looking for any drifting, good. Good, so that's testing the quadricep strength, good. And then while I'm here, I'm going to strike the patellar tendon. Good, and then I would note that normal reflex is 2+. And then I'm also going to do the bicep tendon, so you can flex for me, and then just relax. And I'm looking for the fingers to curl, and that is, would be a normal 2+ reflex. I would note if they were either hypo or hyper reflexive. And now I'm going to do the sensory. And so I'm going to have you close your eyes and tell me now when you feel this. Good. And then we're going to do sharp versus dull discrimination. So you give me your hand. This is sharp, and then this is dull. Keep your eyes closed.
Dull, dull, sharp, 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 dull, dull, sharp, dull, 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 sharp, sharp.
Good. Okay, so that is to ensure that the sensory function is intact. And so now we will test the cerebellar function. So I'm going to have you touch your fingers to your thumbs. Good. And then I'm going to have you touch your finger to your nose and then to my finger. Okay, and then the other one. Okay, good. And then I'm going to have you stand up for me. And then I'm going to have you take your heel and slide it down your shin on both sides. And then I'm going to have you stand with your eyes closed for 20 seconds. And this is the Romberg's test and 18, 19, 20. So that's negative. It would be positive if he was falling over. And then I'm going to have you just do a normal walk. Go that way. Okay, good. And then come back doing heel to toe, looking up. Okay, so I'm noting with, thank you, noting with the gait if there's any, if he's uncoordinated, that he's able to perform heel to toe. So I can state that the cerebellar function is intact. And now I'm going to assess the spine. And I'm going to have you just turn to the side and note the curvature of the thoracic spine and then the lumbar spine. So the convex and concave curvature, and then touch your toes, and then seeing the curvature of the spine, and then also that there's no signs of scoliosis, and then stand back up, and then turn this way, and then just looking at the shoulders, the scapula, and the gluteal folds for symmetry, no signs of scoliosis. And then I'm going to have you turn around and put your hands on your hips, and then just turn your spine without your hips. Good. And then the other side. Okay. And then do a little teapot. Okay. Okay. So that concludes my head to toe assessment.